Anyone who practices medicine will be aware of the difference between studying signs and symptoms in a textbook and how they map cleanly onto a disease, compared to real life where medicine is really messy and things aren't so clear cut. And this is such a big thing in general practice and primary care, where we often see patients very early on in the disease process, and you can imagine in a timeline signs and symptoms are quite nebulous, and often someone won't have all the signs and symptoms of a disease. And in GP we have to deal with so much uncertainty, and I say uncertainty because with risk you know what the probability is of something and you know the consequence. Risk is probability times consequence. But in GP we operate with what's called Knightian uncertainty, which is where it's impossible to fully know the risk or outcome because we don't know the probability and we don't yet know the full consequence because we don't know the diagnosis. So an example would be someone who has hypothyroidism that's subclinical, and they have antibodies, but so therefore we can calculate the risk that that person is going to go on to develop full-blown hypothyroidism. But that is not often the case in many primary care consultations. And I say that because recently I had a case where I had someone who was in a lot of abdominal pain, vomiting, very tender abdomen, and I tried to refer them to the surgical assessment unit, and I was rebuffed by someone saying this is just biliary colic. And what I was trying to explain was the uncertainty level for me based on the signs and symptoms and examining the patient, it breaches the threshold whereby I think this could just be called biliary colic. There is a chance that this isn't just biliary colic because not everything is adding up, and my job is to mitigate the risk, and I say risk, or you could say uncertainty, in that circumstance by referring the patient on to have further investigations, because we deal with as well what's called fat tail distribution, which means that so much of the harm in medicine tends to be caused by extreme events, like that patient may have cholecystitis or perforated gallbladder, and that can be fatal. So yeah, I think it's a difference in hermeneutics and the way of interpreting signs and symptoms, and that patient may very well have gone on to have biliary colic in the SAU, but I still did my job, which is mitigating uncertainty and managing uncertainty in the community.